Does something have health benefits? When you're talking about coffee or eggs, it goes back and forth, it flops like a fish on a riverbank. And the same has been true of vitamin D. Does it help with MS or doesn't it? Well, here's what the latest studies say. Well, hello, and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam. I've been living with MS for 40 years, and I have watched the studies go back and forth. Vitamin D helps with MS. Vitamin D doesn't help with MS. Vitamin D, we're not sure. Vitamin D this, vitamin D that. Well, it never seems to be far from people's minds because somehow they must think that there's something there. And it's so cheap and so easily available. If it would help, it would be great. Well, there's a new study, and we want to look at it together. After that, I want to show you a video by a doctor from Yale who has some very interesting things to say and helps us, I think, clarify what these studies are actually saying. This article, which is one of several that I saw, appeared in MedPage Today on March 10th of 2025. It's called High Dose Vitamin D Reduces Disease Activity in Early Multiple Sclerosis. MRI activity, new lesions were better in the cholecalciferol group. They start out with the key takeaways, which I really appreciate. First of all, high-dose vitamin D reduced disease activity in early MS and clinically isolated syndrome, or CIS, compared with placebo. Number two is that patients taking vitamin D had a longer time to disease activity, 432 days versus 224 days, and that's quite significant. Finally, no severe adverse events were related to high-dose vitamin D. And when they're talking high dose, they're talking very high dose, as you will see. But here's their introductory statement, which is also kind of their conclusion. High-dose vitamin D reduced disease activity in clinically isolated syndrome, CIS, and in early relapsing remitting multiple sclerosis, the DELAY MS clinical trial showed. And they go on to describe the study. Over 24 months of follow-up, disease activity occurred in 60.3% of the group taking 100,000 international units. That is a lot of oral cholecalciferol vitamin D3 every 2 weeks, and 74.1% of the placebo group, reported Eric Thuvino, MD, PhD of the Centre Hospitalier Universitaire de Nîmes in France, and co-authors. The median time to disease activity was longer in people taking vitamin D compared with placebo, 432 versus 224 days. The researchers reported in the Journal of the American Medical Association, or JAMA. As they go on to say, all three secondary MRI outcomes favored the vitamin D group: MRI activity, new lesions, and contrast-enhancing lesions. All 10 secondary clinical outcomes, including relapse, showed no significant difference between the vitamin D group and placebo. So the primary outcome, so I'm a little confused about that actually. So the three secondary MRI outcomes favored the D3 group, but the secondary clinical outcomes were not significantly different between the two groups. So I think the difference is when they talk about clinical outcomes, it must be what you can see. The person comes in, reports certain symptoms or doesn't, or you do an exam and this is what you see, except for the MRI. So maybe outwardly there's no difference, but the MRI shows difference. And they say that severe adverse events occurred in 11% of the vitamin D group and 9% of the placebo group, and none were related to cholecalciferol. Even at that really high dose, that's interesting that they didn't have more side effects that or adverse events that were related to that 100,000 international units dose. That is a really big dose. Vitamin D deficiency, they say, is a risk factor for MS and is associated with an increased risk of disease activity. Studies on the benefits of supplementation have provided inconsistent results. You can say that again, especially as an add-on therapy. It was important to conduct a large randomized control trial to evaluate the efficacy of high-dose cholecalciferol as monotherapy in reducing disease activity in patients with early MS, Duvineau noted. For the first time, a large study analyzing the effects of high-dose vitamin D supplementation on disease activity in untreated early MS shows significant results, he told MedPage Today. Moreover, the effects of vitamin D on reducing disease activity are comparable to those of some available drugs with excellent safety. This constitutes real proof of efficacy in MS. And I want to make a point there. When they say untreated early MS, that is important because, I mean, as you will see later, they're talking about no disease-modifying therapy of any kind, including the steroids that many of us got when we presented with optic neuritis. So you really do need to choose test subjects who are very early in their disease course in order for that to be true, because most of us, if we've had MS for decades, we've been on something. Whether it's an actual disease-modifying therapy like Ocrevus or even an interferon, or we've just been on things like steroids and other symptom-specific treatments. And they're really looking at someone who's pretty well clean of all that stuff. You're going to have to go with an early diagnosed person. But that does not necessarily mean, I wouldn't think, that vitamin D would not be useful for someone who is further on in the disease course. But this study did not look at that. They go on to say that MS often starts with an acute episode involving the central nervous system, like optic neuritis or transverse myelitis. This episode, known as CIS, does not always convert to MS. But more and more, the doctors are starting to treat it as if it probably will be MS so that they can get us on therapies more quickly. They say that from 2013 to 2020, the DELAY MS trial enrolled patients in MS centers in France with CIS based on 2010 McDonald criteria, randomizing 303 participants to 100,000 international units of oral cholecalciferol every 2 weeks for 24 months or until disease activity occurred, or placebo. Patients receiving a disease-modifying therapy were excluded, as we've already said. 1/3 of participants had optic neuritis. The median baseline expanded disability status score was 1.0, so you're very, very early in your disease course, indicating no disability and minimal signs in one functional system. The mean age of participants was 34, and 70% were women. Of these, 303 people took at least one dose of the study drug, including 157 in the vitamin D group and 146 in the placebo group. The primary outcome was disease activity, defined as occurrence of a relapse and/or MRI activity over 24 months of follow-up. Medical visits occurred at 3, 12, and 24 months after baseline and at relapse. At each visit, patients had brain and spinal cord MRI and clinical assessments. The median vitamin D level at CIS diagnosis was 45 nanomoles per liter, with 22.4% of participants having severe vitamin D deficiency, less than 30 nanomoles per liter. The median time from CIS onset to randomization was 54 days. Participants who benefited most from vitamin D were those without spinal cord lesions at diagnosis, those with severe vitamin D deficiency, and with normal BMI at baseline. During the study period, the McDonald criteria for MS diagnosis were updated, allowing relapsing remitting MS to be diagnosed more rapidly in people with CIS. The researchers analyzed a subset of 247 trial participants who fulfilled the updated 2017 diagnostic criteria for MS before starting treatment and found that the results were similar. Lesion detection was done only at the MRI intervals specified in the trial, which didn't necessarily correspond to the moment a lesion developed. Tuvino and co-authors acknowledged EDSS scores were not measured frequently enough to assess a 3 or 6 month confirmed disability accumulation, they pointed out. Whether the trial population was diverse or representative was unknown. Whether the trial population was diverse or representative was unknown because French law precludes collecting race and ethnicity data in this setting, they added. Well, we know one thing, it wasn't diverse in terms of the state of a person's MS. And that does make a difference. It was a very homogeneous population in that regard. And so we don't really know whether this would be a benefit to people in any stage of MS. But since vitamin D is generally good for people in their nutritional profiles, generally good for people, is generally good for our nutritional requirements, I would say that at some point it's good for us to take vitamin D, although 100,000 international units is way high, and I would never recommend doing that without a doctor being around to make sure that we're not hurting ourselves. And the last thing we want to look at is the disclosure here that the study was funded by the Programme Hospitalier de Recherche Clinique of the French Ministry of Health, and Tuvino reported relationships with PHRC, the French National Research Agency, Biogen, Merck, Novartis, Roche, Sanofi, France, SEP, and the EDMUS Foundation. So there's a lot of pharmaceuticals in there, though just because he had relationships with them does not mean that they had a lot of input into this particular study. Co-authors, they say, reported relationships with nonprofit groups and pharmaceutical companies. You almost can't have research going on anymore without pharmaceutical companies in there somewhere. They lurk around like bottom-feeding fish waiting. Am I saying, no, I'm sorry, I don't mean to sound so negative, but I think it's harder for us to know that the results are unbiased when we have pharmaceutical companies anywhere associated with it, because understandably their motive is to make money. And if they see that something will make money, they'll be on it. And if they don't think it's going to make money, they won't care very much. That's why it's kind of interesting that with something like vitamin D, they would be even remotely interested. So again, I don't really it doesn't really make very clear what the relationships are with these pharmaceutical companies and whether they had any actual interest in this particular line of research. But it's always good to know. And we're not going to go through this one in detail because I don't think it tells us much that we didn't already see. But this is an article that came out in Medscape that I saw. It was published on March 13th of 2025. And you'll notice how definite the title sounds. High-dose vitamin D curbs disease activity in early multiple sclerosis. It doesn't seem to suggest that there's any doubt about it, or it doesn't say what they normally do. Things like, it is suggested that vitamin D curbs disease activity. None of that. It sounds very definite. But if you've been following this issue in medicine for a long time, which I have, you always want to know, what is the basis of the enthusiasm? And is this going to maintain its status as a good thing for long, or are they going to go back to thinking that, well, vitamin D doesn't really help after all? There's an article that I want to look at. It's not actually an article. It's going to be a video here in a second, which I'll play for you. But it's in an article called A Rare Win for Vitamin D, this time in MS. And this was published on March 10th of 2025. And the gentleman in the article is Dr. F. Perry Wilson. Let's go ahead and take a look at that video because I find it really interesting what he has to say. He expresses some of the concerns that I have, some of the skepticism that I have, even though, of course, I take vitamin D and I believe that it's helping me in general. I don't know whether it's the miracle for MS that these articles seem to indicate that it might be. But let's take a look at his video and hopefully, and you'll see that he's got a lot of good points, that he makes a lot of good points.
Study after study across diseases from Alzheimer's to Zika virus have shown that low vitamin D levels are risk factors for bad outcomes. Seriously, I challenge you to find a disease state where there isn't at least some data suggesting worse outcomes among people with vitamin D deficiency. And yet, when the inevitable randomized trial of vitamin D supplementation comes around, you get nothing. It's become a bit of a running joke on this blog. The compelling observational data shut down by the definitive randomized trial. So we have good data that low levels are associated with various problems, but a failure to show that correcting those levels makes a difference. The implication is simple. It's the classic case of correlation versus causation. Low vitamin D levels are simply correlated with bad outcomes. They don't cause bad outcomes. It's not actually the vitamin D that is causing the problem. People who are sick for other reasons just happen to have low vitamin D. I actually give a lecture to the med students citing just these studies to convince them that randomized trials are superior sources of evidence than observational research. That said, science demands that we reevaluate our priors when new data arrives, and new data has arrived in the form of a randomized trial that, for once, shows a benefit of vitamin D supplementation. In just one disease, yes, but it's an important one, multiple sclerosis. People with lower vitamin D levels have a higher risk of multiple sclerosis, and of those who develop multiple sclerosis, those with lower vitamin D levels have worse symptoms. But that's the case with, well, just about every disease, because lower vitamin D levels are a marker of a lot of things: poorer health overall, less sun exposure, a less varied diet, and so on. It's a biomarker of a healthy lifestyle. So it's not surprising that several prior randomized trials of vitamin D supplementation in MS have been disappointing. But a trial can be negative for a few different reasons. There's the common one: the treatment just doesn't work for the disease. But there are other possibilities. Maybe the treatment was given at the wrong time, or when the disease had progressed too far, or maybe the trial simply didn't enroll enough people to detect a reasonable signal. Now, this study from Eric Touvenot and colleagues appearing in JAMA remedies some of those prior deficits and suggests a new role for vitamin D in MS. Let's break down how it worked. The investigators enrolled 316 individuals with clinically isolated syndrome, or CIS. CIS is basically the earliest possible presentation of MS, a first episode of an MS-like syndrome, such as optic neuritis. Not everyone with CIS will progress to full-blown MS, but many do. So the first special fact about this trial is they are hitting these participants early. The second important difference from some of the prior work is the vitamin D dose. The intervention group in this trial got 100,000 international units of oral cholecalciferol every 2 weeks. This is a big dose. The vitamin D3 you get at the local vitamin store is 1,000 international units. This dose is 100 times that, even dosed less frequently. It's a lot. That is not without risk. Supratherapeutic doses of vitamin D can cause elevated calcium levels, kidney stones, nausea, vomiting, confusion, and so on. I'll get to whether this happened in this study in a bit. But first, let's look at the patient population. A fairly young group, remember, they were enrolled at the first MS-consistent symptom. The average age was around 35. 70% were female, and 40% were active smokers. The study was conducted in France, where smoking is more prevalent. About 20% had severe vitamin D insufficiency, a level less than 30 nanomoles per liter. The average time to receiving either the vitamin D or placebo was about 60 days from the initial presentation. By that time, 80% of the study population had received high-dose steroid therapy, which is pretty much standard of care. I'll point out that no one in this study received disease-modifying therapy like interferon treatments. That was an exclusion criterion. So basically, this is a population of young individuals newly diagnosed with early MS who are not at super high risk of progression, at least at the time the study started. But I'm sure you want to see the results. The primary outcome of this study was disease activity. And you could hit that outcome in two ways. First, a relapse of symptoms. Second, the development of new or growing lesions on MRI. MS has some characteristic findings on brain scans, as you can see here. Participants got follow-up MRIs at 3, 12, and 24 months. So let's take a look at what happened. 74% of individuals in the placebo group had an increase in disease activity. 60% of individuals in the vitamin D group had an increase in disease activity. That's a 14% absolute risk reduction, which is fairly impressive. It means that you would need to treat 7 individuals with early MS with vitamin D to save 1 person from disease progression. That's not bad, especially for a relatively inexpensive intervention like a vitamin. The median time to progression was significantly longer in the vitamin D group as well, 432 days versus 224 days in the placebo group. That's around a 7-month difference. So far, I'm impressed, but let's take a look at some of the subgroup analyses to figure out what might really be going on here. The first thing I want to show you is the effect of vitamin D supplementation stratified by baseline vitamin D level. What you see here is that the supplements are dramatically more effective when the patient has vitamin D insufficiency to begin with. This isn't particularly surprising, I suppose. It's fairly typical that vitamins have threshold effects. Once you hit a target, for vitamin D, something like 50 nanomoles per liter might be reasonable. Getting higher above that target doesn't offer too much extra benefit. The other significant finding was this: the vitamin was much more effective in people without spinal cord lesions, in other words, in people with a less severe initial presentation. Adding to the implication that vitamin D might be best among people with less severe disease, we see that it seems to work better among the minority of people in the study who did not get IV steroids at the initial diagnosis. The fact that they didn't get that therapy suggests that their presentation was milder. So, should we only be giving vitamin D to those with an initial presentation of MS that's fairly mild? The answer to that question depends exquisitely on the risk of high-dose vitamin D supplementation. If it's very risky, you'll want to limit its use. If not, well, maybe it's not as effective in those with worse disease, but maybe it couldn't hurt. And it seems pretty darn safe. Only 2 patients developed hypercalcemia during the trial. Both of them were in the placebo group. No one developed severe hypercalcemia or kidney failure. It may be a bit early to look for kidney stones, though. Still, it's hard to look at this trial as anything except a powerful, and to me at least, unexpected victory for high-dose vitamin D supplementation in early MS. I think those testing vitamin D for other disease states who look at the literature and see all those negative trials might do well to learn some lessons from this study. If you want to design the next positive randomized trial of vitamin D, maybe start supplementation early, and when you supplement, go for bigger doses. Will it work for all those diseases from Alzheimer's to Zika? Of course not. But the first step to finding therapies that do work is to design the proper study to figure it out. For Medscape, I'm Perry Wilson.
Well, I don't know. At this point, what do you think about vitamin D? Are you taking it now? And if so, how much? I'll tell you that I'm taking 5,000 international units every day. And I've been doing that for years. I don't even know how long I've been doing it. But I don't think I was doing it when I first was diagnosed with MS or when I first started having optic neuritis. Wouldn't have mattered anyway for this study because I got steroids. I got prednisone treatment pretty quickly, so I would have been ruled out of this study. That doesn't mean, though, I don't think it means that just because you had some kind of DMT or some kind of a treatment that vitamin D wouldn't help you, although these results sort of suggest that. Kind of strange. I'm not really sure about that. But regardless of where you are in your MS journey, it probably doesn't help to supplement with vitamin D if your levels are low. Your doctor can tell you there's a simple blood test that can be done. It's probably worth it, even if the insurance doesn't pay for it. It's probably worth knowing. And if you need to supplement, the over-the-counter little pills, they're very effective. They do a good job. I know they've gotten my vitamin D up to the levels where the doctors are happy with it. So I'm just going to stay the course. But let me know what you have decided about vitamin D and what does this study say to you? Does it make any difference, or are you just waiting for the other shoe to drop and them to start saying, it doesn't really matter after all? Okay, well, that's all I have for you today. But until my next video, please do continue to take really good care of yourself, whatever that looks like.